If you're smoking right now, I can tell you with full responsibility that you're slowly killing yourself. Around 8 million people die each year worldwide from smoking-related diseases, and this number is steadily increasing every year. Almost every 2 seconds, someone loses their life due to smoking. According to data from the World Health Organization, smoking is not only a leading cause of lung cancer, but also closely linked to heart disease, chronic obstructive pulmonary disease, diabetes, and many other illnesses. It's not just smokers who suffer. Secondhand smoke is equally deadly. Approximately 1.2 million people die each year globally due to secondhand smoke. It's like a hidden time bomb, silently eroding your body from your mouth to your lungs, from your heart to your immune system, and even affecting fertility. So how does a tiny cigarette gradually destroy your health? Let's dive deeper. The cigarettes we commonly see contain more than just tobacco and a filter. Hidden behind them are over 7,000 chemical compounds, at least 69 of which have been scientifically proven to be carcinogens. These include nicotine, tar, carbon monoxide, heavy metals, and radioactive substances like polonium-210. When you light a cigarette and take that habitual deep drag, lost in the pleasure of blowing smoke, you might not realize the havoc cigarette smoke is wreaking in your mouth. With every puff, harmful substances like tar, polycyclic aromatic hydrocarbons, and nitrosamines quickly come into contact with your oral mucosa and teeth. Tar doesn't just stick to the surface of your enamel, turning your teeth yellow and black with stubborn stains. It also weakens your gums' resistance to bacteria, causing redness, swelling, and bleeding. Long-term smoking destroys periodontal tissue, leading to recurring inflammation. But these aren't even the worst consequences. The carcinogens in tobacco constantly irritate the oral mucosa, causing cells to mutate and leading to cancers of the tongue, cheeks, gums, and more. Smokers face a 2 to 3 times higher risk of oral cancer compared to non-smokers. Every year, thousands of people develop oral cancer due to smoking, and this cancer has an extremely high mortality rate because it's often detected too late. When we talk about smoking, nicotine is unavoidable. It's not just an ordinary addictive substance, it is actually a potent neurotoxin. Once nicotine enters your body, it quickly crosses the blood-brain barrier and reaches your brain in just 7 seconds. By binding to neural receptors, it stimulates the brain's reward system, triggering a massive release of dopamine. That's why you feel relaxed and happy. But this pleasure is fleeting. Nicotine's true nature is to make your brain dependent on it, pushing you to consume more and trapping you in a vicious cycle of addiction. Let's put this into perspective with a simple comparison. Watching an exciting TV show increases dopamine levels by 15 to 20%. Intimate moments with a loved one boost dopamine by 30%. But with smoking, every single puff sends dopamine skyrocketing by 200%. The intensity of this pleasure far surpasses binge-watching or a romantic date, but it fades just as fast, forcing you to light up again to chase that feeling. Over time, your brain builds a tolerance to nicotine, making each cigarette less satisfying. To recapture the high, you inhale more nicotine. Here's something alarming. Nicotine itself is deadly in tiny doses. Just 0.5 milliliters of liquid nicotine can kill. During World War II, Nazi doctors used nicotine injections to execute prisoners. Just a small dose could make an adult suffocate to death in 90 seconds. The process was horrifying. Victims would claw at their throats, struggling desperately before dying from respiratory paralysis. Research estimates that 1 gram of nicotine is enough to kill 20 people, making it 6 times more toxic than arsenic. This isn't fear-mongering, it is scientific fact. Your lungs are the most direct victims of smoking. Tar sticks to your airways like asphalt, paralyzing the cilia that keep them clean. Free radicals ravage the elastic fibers in your alveoli, robbing your lungs of their ability to expand. Carcinogens alter your cell's DNA, triggering cancer. Chronic inflammation leads to bronchial spasms, causing COPD and asthma. These damages intertwine, turning one's soft lung tissue stiff and shrunken. Healthy lungs are pink and elastic, efficiently filtering impurities from the air. A smoker's lungs, however, are dark and stained with tar and toxic chemicals. Studies show smokers' lungs accumulate over 30 known carcinogens. Around 4 million people die each year from smoking-induced lung cancer. Many smokers only realize their lungs are black when they start coughing up blood. One described the black phlegm doctors pulled from their lungs as looking like charred bacon. Smoking doesn't just destroy your lungs, it also drastically increases your risk of heart disease. Nicotine and carbon monoxide from cigarettes enter your bloodstream through the alveoli. Nicotine activates your sympathetic nervous system, triggering adrenaline and noradrenaline release, which spikes your heart rate and blood pressure while increasing oxygen demand. Carbon monoxide hijacks red blood cells, drastically reducing their oxygen-carrying capacity. When your heart senses oxygen deprivation, it pumps faster to compensate, but this emergency mode strains it like an overloaded pump, risking failure. Together, nicotine and carbon monoxide cause blood vessel spasms and endothelial damage, doubling your risk of coronary heart disease and heart attacks, while significantly raising stroke risk. Even without obvious symptoms now, smoking inflicts long-term, hidden damage on your heart. Smoking also weakens your immune system in multiple ways. The toxic chemicals in cigarettes impair immune function, dulling your body's defenses and making you more vulnerable to infections. Smoking accelerates aging, slows wound healing, and prolongs recovery from illnesses. Smokers catch pneumonia and flu more easily and take longer to recover than non-smokers. The harm smoking does to reproductive health is equally severe for both men and women. For men, nicotine suppresses the hypothalamic pituitary gonadal axis, reducing sperm concentration by 30% while increasing abnormalities by 45%. Carbon monoxide disrupts testosterone production, leaving about 30% of male smokers with erectile dysfunction. Many men quit before trying to conceive to ensure their children's health. For women, the reproductive system is highly sensitive to cigarette toxins. The ovaries, crucial for fertility, react strongly to smoke. A woman smoking 10 cigarettes daily loses 19% of her egg reserve and enters menopause 2.5 years earlier. Smoking during pregnancy is especially dangerous, raising miscarriage risk by 78% and doubling the chance of placental abruption. But hope isn't lost. 6 months after quitting, sperm vitality improves by 40%. Women under 35 who quit see their fertility rebound to near non-smoker levels. The history of smoking dates back thousands of years. Indigenous Americans first used tobacco in rituals and medicine. After Columbus brought it to Europe, it spread among the elite. By the 18th century, smoking entered mass markets, with cigarettes and cigars becoming everyday items. In the early 20th century, tobacco companies marketed smoking as fashionable and social. But as medical research advanced, especially in the mid-20th century, scientists uncovered smoking's dire health effects. Studies in the 1950s first proved the link to lung cancer. By the 60s, the WHO and governments worldwide issued warnings, restricting tobacco ads and making smoking a global public health priority. Your body's healing mechanisms never stop. After quitting, health risks drop dramatically. Within 20 minutes, heart rate and blood pressure normalize. 12 hours later, carbon monoxide levels in blood return to safe levels. In 2 weeks, circulation and lung function improve. After a month, coughing and shortness of breath ease. 1 year smoke-free cuts heart disease risk by half. 5 years later, stroke risk matches a non-smoker's. 10 years post-quitting, lung cancer risk halves. After 15 years, heart disease risk equals someone who never smoked. If you want a full, healthy life, stub out that cigarette now. Make sure to hit that subscribe button, give this video a thumbs up, and share it with your friends and family. Thanks a bunch.